local urgent care. So we are back down, it looks like closer to normal. So overall, cumulative number of people who've died with COVID-19 is at 722. 5 new deaths were reported to us yesterday. And again, remember, the daily increase doesn't necessarily mean that it happened in the last 24 hours. It could likely have happened in the last days and weeks. So hospitalized, the cumulative number of people hospitalized is 4,628. 28 of those were added yesterday. And the number of people in Mobile County hospitals yesterday was 106, down 4. So again, things moving in the right direction. Really nice, steady reduction in the number of cases and the number of hospitalizations. And we're looking for those deaths to plateau as we get further and further away from the spike in cases that occurred over the holidays. All right, vaccine. We released some information a little bit earlier today about the Mobile County Health Department vaccine clinics. And we had one today at the cruise terminal. So that one's, I think, pretty much done or wrapping up by now. I think they're loading out. Tomorrow, very exciting, we have a first dose vaccine event at the cruise terminal. That's 201 South Water Street in Mobile. It's tomorrow, February 25th, from 9 a.m. to 2 p.m. And just to remind you that those that are currently eligible for COVID vaccinations are people 65 and older, healthcare workers, first responders, people in hospital-based occupations, including clergy, government workers like legislators, courts, personnel, judges, constitutional officers, cabinet heads, that sort of thing, correctional officers, food and agricultural workers, postal workers, manufacturing, grocery store, public transit workers, and people who work in the education sector, teachers, support staff, community colleges, higher education, faculty, staff, that sort of thing. Child care workers and people who work in the judiciary system, so circuit judges, district attorneys. So again, there are no appointments, there are no lists. There is first come, first serve. We'll be there from 9 to 2. Generally, the morning lines work through really pretty well. And then as the day goes on, there's usually less and less waiting. So if you want to sort of arrive, late morning, that might result in less of a wait. But so tomorrow, first dose event, Alabama Cruise Terminal. We're going to have another first dose event on Saturday. This will be in our sort of co-located with our Saraland activities at the Redemption Church at 1251 Industrial Parkway. So we are partnering with the Redemption Church, but it will be staffed by Mobile County Health Department and some folks from the church helping us with direct traffic and that sort of thing. Again, this was is a heavily impacted area for COVID. So that will be Saturday, February 27th, Redemption Church, 1251 Industrial Parkway, from 9 a.m. until we run out of vaccine. So other second dose vaccination clinics that we have announced, and these are on our website at mchdcares.com. If you can't listen or write down as fast as I'm talking, don't worry. So Friday at the cruise terminal, a second dose event for anyone who received their first dose on January 29th. And then we're going to start running through the second doses for some of the outlying locations that we did a few weeks ago. So if you got vaccinated by the Mobile County Health Department at our Sims Clinic on Wolf Road on February 2nd, return to the same location on March 2nd between 9 and 2 for your second dose, and bring your vaccine card that documents that you got vaccinated there. If you were vaccinated at the 8 Mile Clinic on St. Stephen's Road on February 3rd, return to that location on March 3rd from 9 to 2 p.m. If you were vaccinated at our Citronelle Clinic on February 4th, then return to our Citronelle Clinic on North Mobile Street on March 4th from 9 to 2. And then if you were vaccinated near our North Mobile Mount Vernon Clinic at Belisol Middle School on February 8th, return to get your second dose on March 8th between 9 and 2. So remember, on these second dose events, you have to bring your card, your vaccine card, as proof of your initial vaccination. It's only for MCHD vaccinees who receive Moderna from us. So if you don't have your card, or you lost it, or you forgot it, just be prepared to wait a little bit, as we'll have to look that up and verify that you received your first dose from us. So again, you can get this information at mchdcares.com, our website that will provide info, or you can call 251-410-6243. That's 251-410-MCHD or 6243. I always get that mixed up. All right, it's right here in front of me and I still get it wrong. So again, 251-410-6243. All right, some other things that have been in the news. We had a news release yesterday talking a little bit about some of the new CDC guidelines around quarantine, and also we've been getting some questions about, now that the UK variant has been found in Mobile and we know it's circulating here, what does that mean with regard to vaccination and treatment and testing and that sort of thing. So we provided some information that both the Moderna and the Pfizer COVID-19 vaccines provide protection against the B.1.1.7 variant strain of COVID-19, or what's also called the UK variant. So preliminary data does indicate that it's more transmissible, so that's pretty well known at this point in time, anywhere from maybe 40 to 50% to maybe as much as 60 to 70% more highly transmissible than the parent strain of SARS COVID-19. So it is more transmissible. And, because you could potentially be, infected by this new strain, because we want, it's highly infectious, and we want to protect everyone as much as we can, even if you've been vaccinated, even if you had COVID before. Please continue wearing a mask and socially distancing and staying at home if you're sick, and avoiding crowds to try to slow the spread of this new variant that is more highly transmissible. Again, the vaccine is effective against it. The current therapies that we have are still, help improve illness in people that have the new variant, but we still want to be extra cautious, because many of the national experts are expecting that this UK variant could outcompete normal SARS-CoV-2, and maybe by April we may start to see another peak because of the spread of the UK variant. So please help us slow that down so that we can avoid another increase in cases and hospitalizations like we saw in December and January that really maxed out our healthcare system. All right, there are some other guidelines out from CDC that may be important to those of you who have had COVID or been vaccinated. So for a really long time, we have said, if you have a COVID diagnosis, so if you test positive for COVID, then we want you to not get tested for at least 90 days. And during that 90-day period, you don't have to quarantine if you are exposed to someone who has COVID, as long as you're asymptomatic. Okay, so if you're sick, you have to stay home. But if you had COVID, if you had a COVID positive test and you're asymptomatic, then for 90 days, please do not test again, and you don't have to quarantine if you're exposed to someone with COVID. That same rule applies now for people who are fully vaccinated. And by fully vaccinated, we mean you have had 2 doses of vaccine, and at least 14 days has passed since your second dose to give your body time to build the highest level of immunity that you can from those vaccinations. So if you have 2 doses of vaccine, it's been 2 weeks since your last dose, and within 90 days and you're asymptomatic, then if you're exposed, you do not have to quarantine. If at any time you become symptomatic, then you need to go home. So our Dr. Laura Cepeda, our Chief Medical Officer, reminded me and others today that the vaccines are 94 and 95% effective, but that still means that 1 out of 20 or 500 out of 100 people vaccinated may get disease if they are exposed to COVID. So we know that to expect some breakthrough cases of COVID in people that have been vaccinated. So again, all of this is contingent on you being asymptomatic. But if you've had COVID or you've gotten your full vaccination series, then for some time you won't need to quarantine as long as you're healthy. All right. So there really weren't any questions today, just two small things. Someone asking about longevity of either of the vaccines beyond 90 days. So, we're still learning. The clinical trials taught us a lot, but now we have, tens and 20s of millions of people who have been vaccinated. And much about what we know now about the COVID vaccines, we're learning now. For example, that there are not any, unanticipated severe adverse events associated with COVID vaccination. There are some that occur, but they're extremely rare. So the vaccine is very safe. And so we will also learn about the true longevity of your immune system, of your immunity after these vaccines as we move along. I think part of the reason for the 90-day time frame for vaccination also has to do with the fact that the variants are starting to circulate here in the United States. So, the current vaccines are very effective against the UK variant, but there are other variants circulating here, and they're less common. And so vaccine manufacturers are steadily working to determine if the current vaccines are effective against the other strains, and if so, to what extent, and if they aren't as effective as we need them to be to get that elusive herd immunity, then what do we need to do to kind of, boost the immune system to be able to respond to these other variants? So that has, federal leaders thinking maybe we should just go for 90 days right now and just wait and see what happens with the variants. And then someone else asking about, the question was, so you don't have to quarantine as long as you're asymptomatic. This is a big change. Is that correct? So yes, if you have tested positive for COVID within 90 days, or you have fully vaccinated within 90 days, you don't have to quarantine as long as you're asymptomatic. That is correct. All right, that's it for today. We will be back tomorrow, let you know how successful our vaccine events went. And just to remind you again,